Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Have you ever walked into the gym feeling really motivated, only to leave with a tweaked knee, a sore shoulder, or an aching back? Today we're talking about the injuries that can happen to anyone, from beginners to experienced lifters, and maybe how to prevent them before they happen. Prepare to go full Brusovanik, because I got your back. On this episode of Ask the Doc, no appointment needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I am Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question from Alan. Alan asks, "Hey, Dr. Brew, I'm a freshman in college and made the school soccer team. I've never been on a team with a trainer before, and our trainer suggested that I stretch before hitting the weight room. Just how important is it to stretch? I have a lot of pain when I bend backwards." Okay, this is a really good question, Alan. I can't tell you how much I appreciate you sending this to us. So the particular concern about your question is that you have pain when you bend backwards. So in an average individual, whether they stretch or not, there's very little difference long term. And as we get older, we get stiffer. It's important to stretch so as to widen the margin of what we're capable of doing while we're working out. But in your case, the fact that you bend backwards is a bit of a red flag. And the fact that you are young goes along with the red flag like this, because there is this significant population of young people who go through their lives with a bit of a congenital abnormality, specifically a failure of formation of a tiny bridge of bone involving the L5 vertebra. There's a few names for this. It's known commonly as spondylolysis. And sometimes you hear young people say that they have what's called a pars defect. Now, if I were you, I would get an MRI and really understand why you have pain when you bend backwards. It's a good idea to stretch. And the fact that your stretching has elicited this pain tells me that before you go hard, I would get that checked out and make sure that your spine is perfectly sound. I appreciate this question, Alan. Thank you. Our next question comes to us from Tandy, who reached out on our YouTube page. Tandy's question is, "Dr. Brusovanik, are there certain red flag symptoms after a workout that mean you should seek medical attention immediately?" Okay, Tandy, thank you for reaching out and sharing this really, really important question. I do have a short list of things that would fit your question. Specifically, if you finish a workout, and it's normal to have a fast heart rate during a workout, but you finish, you get into the car, and your heart is still racing. I would go straight to an urgent care center and get an electrocardiogram. Make sure that your heart is functioning normally. Feeling dizzy. Another one, feeling dizzy in general is a sign that there isn't enough blood flow going to your brain. And if you just finished the workout, your blood vessels, if they're acting appropriately, are supposed to get real tight to push more blood into your brain. If you feel dizzy after a workout, it could be a sign of a problem, and not just one problem, because a heat stroke can present in a similar way. Definitely go to an urgent care center and get evaluated. Number 3, facial or extremity numbness. Now, you may have symptoms of tingling or numbness throughout your life due to disc degeneration. But if you feel this after a workout, a concern is whether this is a sign of an impending ischemic attack or insufficient oxygen reaching your brain. I would definitely not even drive to an urgent care, pull over, call 911, and have them take care of you. Please, this is a really, really important comment. Number 4, can't stop sweating. That's a common finding after a heat stroke. And if you overdid it, can't stop sweating may result in suddenly passing out. So don't drive to a doctor. Stop and call 911. And the last one is chest pain. It goes without saying, if you overdid it and your chest hurts, you got to make sure you're not having a heart attack. So it's important to get that evaluated. Thank you for this really important question. The next one is coming to us from Daryl. Dr. Brusovanik, I'm a 65-year-old man and I just started going back to the gym. Good for you. Unfortunately, I hit it too hard and now my lower back is killing me. What can I do? Well, first of all, Daryl, don't blame yourself. You could have had an injury. You could have overdone it. But the reality is that if you describe your pain as killing me, then like anyone with a new pain, you deserve an evaluation. You deserve an MRI, which is a study that looks at soft tissues, that looks at your muscles, looks at your discs and nerves, and you deserve a proper evaluation with a spine specialist. Very important question. Before you panic and run to the doctor because of aches and pains after a workout, just know that rhabdomyolysis is extremely rare. We really only see this in military recruits who are pushed beyond physiologic limits. So don't let this scare you away from enjoying a regular workout or even an intense workout. I hope this helps. Welcome back. Our next question was submitted via our very own website at allhealthtv.com by Zach. Dr. B, my wife is in her early 40s and recently decided to join a boot camp type gym. I've seen people get super fit after those kinds of workouts, but I've also seen people get injured too. What does she need to know to prevent injury? Zach, that's a really good question. I've also seen a lot of injuries when workouts are taken to the extreme, when free weights are used. And free weights, you have to have a lot of control. So if you're just jumping into the free weight category, which is common for these types of gyms, there is a potential to get injured. So important form makes a difference. Lifting with your legs, not bending over as much when you lift heavy. And in general, things like the crossbar that you sort of reach overhead. I mean, this is an intense workout, and I wouldn't necessarily recommend that to a beginner without having someone there, someone who is experienced, especially like a trainer. Now, theoretically, Zach, if you were to listen to your body, and if you felt that some amount of weight is just too much, there's no better source of information. In other words, what's normal for you is unique to you, and no one, including an experienced trainer, can really tell you what is the right weight for you. I would recommend starting low and then sticking with consistency as opposed to just maximizing the weights. But in general, the more you work out, the better. And if I may just chime in on one thing, I like muscle confusion, meaning that if you like one gym so much, I would go there multiple times a week, but not every day. And consider splicing the workouts at that gym with other workouts that will use other muscles, other techniques like swimming or basketball or soccer. So consider sort of confusing your muscles and letting the other muscles work out that you just worked out, heal and rehabilitate for your next attempt. I hope this helps. This is a really, really important question. Our next question comes to us from Ashley. Dr. Brusovanik, my husband has recently had some trouble with his back. He continues to go to the gym despite the back pain. What do you think about that? Okay, Ashley, that's a super good question. And similarly to the previous answer, when I answered Zach, I really advise you to listen to your body. Now, pain that doesn't get better within a normal amount of time, within a day or two, is not normal. Pain that that continues through the night is not normal. Any pain that goes down to the extremities and feels electrical is not normal. And pain that's worse when sitting is not normal. So what does that mean? It's not a reason to panic, but it is a reason to address this pain specifically by seeing a specialist. For most aches and pains, a short non-steroidal medication course can help. But in general, I'm aggressive when it comes to diagnostic modalities. So if you have pain after you sit, if you have neck pain that goes under your shoulder blade after a tough workout, I would definitely ask your doc, really push to get an MRI. I hope this really answers you and helps you in guiding your workouts. Thank you for this question, Ashley. Next up, we've got another question from allhealthtv.com. You should really check out our site when you get a chance. It's chock full of great information. Wallace asks, hey doctor, how can older adults stay active in the gym while protecting their joints and balance? I'm asking because my grandfather is thinking about hitting the gym again after a 5-year hiatus. Wallace, that's a great question. And at the risk of sounding redundant, I would advise you to advise your grandfather that it's really a good idea to listen to your body, not push it to some limit set by the trainer, but to really feel out what's okay for you and what's not, and start slow and start low. Now, that being said, I'm all about muscle confusion. So if you were to go to the gym Monday and Wednesday and Friday, I would go swimming, let's say Tuesday, Thursday, and Saturday. And that kind of change in pace may allow your muscles to rehabilitate better and lower the risk of injury. In general, trust your grandfather's experience. I'm sure he knows how to stay away from traumatic injuries, especially at the gym. I hope that his stint at the gym will be very successful. Wallace, you're a great grandson. Thank you for reaching out. The next question comes to us from YouTube by Arya. Hi, Dr. Brusovanik. My hubby and I just joined the gym after being pretty sedentary the past few years. In an effort to be proactive, I'd like to know what one should do immediately after tweaking their back, knee, or shoulder during a workout. So, Arya, that's a great question. First thing I would advise is just to rest. A lot of these things that you feel new, de novo, sort of at the gym, they're going to come and go. So I wouldn't panic. I wouldn't catastrophize a new kind of pain. Now, let me be more specific. You may tweak your shoulder, have no pain, get home, and then have a terrible night of pain, especially laying on your side. Now, that means you are getting a capsulitis type problem, and for that, I would advise stretching. If that doesn't work within a day or two, or if you feel like it's making you worse, then I would definitely seek a specialist and see what the problem is. Now, knee pain. If you tweaked your knee and walking on it hurts, if it's swole up, then it's important to get an evaluation, especially if your knee is now swollen. Now, if your knee just suddenly hurt, there was a click and it went away, the probability is that it was a click of a meniscus, and that may be something that's a lot less dangerous. So if your pain allows you to continue, as in your pain is getting dramatically better and you feel no residual pain, maybe you're just a bit stiff, then it's reasonable to go to the gym. Now comes your back. Now, it's generally acceptable to have some back pain. I can't tell you how often I hear patients say, oh, well, this is just my normal back pain. No back pain is normal. No pain is normal. If you were to lift heavy and you say your back is stiff, I get it. If you were to move furniture and your back is hurt, I get it. But then your back should just get better faster, quickly, because then we assume that it's just some kind of a muscle tweak or a sprain. If you have nerve pain or pain starting from your spine and going to your extremities, arm pain or lower extremity pain, if you have difficulty sitting after the gym, or after just a few days your pain is still there and it's not getting better, then that's not normal. Then you definitely deserve a proper evaluation, which in my book consists of a conversation with a specialist, an MRI, and possibly a short course of anti-inflammatory medications to remove the possibility of this being an acute injury and to really maximize conservative care. A steroidal medication is acceptable as well, but the bottom line is no pain is normal. And if this isn't getting better quickly, like within a day or two after going to the gym, then you deserve a proper evaluation. Thank you for this really good question, Arya. Welcome back. Lars just sent us another question on YouTube. Lars asks, Dr. Brusovanik, I'd like to know where you stand on folks using wearable supports like knee braces, lifting belts, or wrist wraps. Are they really protective, or do they promote bad habits? Lars, this is not a straightforward question. Generally, I think that going to the gym is important to be done in perfect health, meaning that you should try to not have to have a brace or straps. You should do what's physiologically normal for your body and stuff that you don't need to have protection for. That being said, a lot of folks are wearing back braces. Are you supposed to just stay home and not work out? Obviously not. So I would differentiate it as such. If you have to have your back brace to go work out, then it's becoming into a crutch. and you need an evaluation. You need to see why you are having so much pain. If you're having knee pain and your knee's clicking and swelling, and you have to have a brace to go to the gym, then you need an evaluation. Now, that being said, I see folks lifting heavy using wrist straps as a protective device. There's something to be said about joint position sense or proprioception that gets improved once you have a brace or some kind of a sleeve. So I'm not necessarily opposed to wearing these kinds of protective devices, as long as that's not something you have to do to go to the gym. If it's becoming something like a crutch where you can't function without it, then you deserve an evaluation to understand why you are suffering. This is a really important question, Lars, and to our listeners in general, I would, at the risk of repeating myself, I would like to really state that if you're having pain that requires you to have an assistive device, you need an evaluation. This isn't the time to get tough and to just push through it. If you have to have a device like a brace in order to function normally, then you deserve to get a diagnosis or a reason why you are suffering via proper evaluation and proper advanced studies like an MRI. I hope this helps. Our next question comes to us from Stephanie, who reached out via Facebook. Hello, Dr. Brusovanik. What's the safest way to return to the gym after back surgery? Oh, great question, Stephanie. Really a great question. So I would definitely talk to your surgeon, because the surgeon who operates on you hopefully is experienced to know how much he needs to protect his patients. In other words, classic spine surgery that is often associated with 4 to 6 months of recovery. Classic spine surgery where your spine is destabilized. This will often require a brace. Now, minimally invasive spine surgery where you sneak in, correct the problem, and sneak out without a significant damage to the body oftentimes does not need any protective devices. And I, for example, let my patients go to the gym whenever they're ready, oftentimes between 2 to 3 weeks after surgery. And then I coach my patients to really listen to their bodies, do things that feel comfortable, don't push it beyond the limits. Now, there's some things that you may find really disturbing, Stephanie. For example, if you go to the gym after surgery, especially classic spine surgery, you may find that your hamstrings are exceedingly tight. And you try to stretch your hamstrings, and it makes you cry, as in that's how much pain it's causing you. I hear this story so often that, believe me, it's worth repeating. You go to the gym soon after classic big wide open spine surgery. You sit on the floor, or somebody helps you stretch your hamstrings, and you're crying in pain. This is a sign that it's not your tight hamstrings. You are stretching a nerve, or the S1 nerve root. Hamstring stretching is supposed to feel good. And a very common mistakes I see is in well-meaning trainers pushing their clients to stretch their hamstrings, not realizing that they're actually causing harm. So in general, Stephanie, as you go back to the gym, consult your doc, but mostly listen to your body. And if anything feels untoward, if anything feels searing, electrical, or if you feel like your old pre-surgical pain is back, stop immediately and demand that your doctor obtain some proper imaging to make sure that nothing bad has happened. Thank you for this really good question, Stephanie. Okay, our next question comes to us through allhealthtv.com from Edison. Hi, Dr. Brusovanik. What are the most common gym injuries that you see resulting from improper use of gym equipment? Edison, I think that lifting too much is the most common injury. When someone tries the clean, where you lift the dumbbell over your head, you are asking a lot. There are a lot of vectors going in all sorts of direction. And if you're just starting this out and you take a heavy weight, you are risking overextending your spinal capacity, meaning that you will go beyond what's normal for your back. And that means hyperextending the joints in the back of your spine, using the muscles beyond their physiologic capacity, or overloading the discs. So oftentimes I'll hear patients come to me saying, I was at the gym, I was lifting, and then the pain didn't begin right away. It wasn't until the nighttime or the day after that now I can't move, I'm stuck in bed, and I have pain going down my legs. I would say that's the most common mistake. If you use a trainer or a well-meaning therapist, you have a much lower chance of sustaining an injury. But even in that case, there is no better guide to knowing what you can and cannot do than listening to your own body and seeing what feels right and what feels anxious or anxiety producing, what feels like it's going to cause a problem. No one knows your body better than you yourself. So definitely consider that advice after you talk to your doctor and make sure that he or she is comfortable with you pushing the limits on their operation. That being said, minimally invasive spine surgery, disc replacement, you can go to the gym right away as soon as your body allows. Great question. Thank you. Next question is from Nina, and via Instagram, she writes, "Hey, Dr. B, my daughter Dylan wants to make her school's swim team next year. So she's been hitting the gym and working out every day. Being a former student athlete, I know how important it is to spend some recovery time between workouts, but I can't get her to listen to me. Would you mind sharing some of your vast knowledge with her?" Nina, thank you for overstating my knowledge as vast. I appreciate it, but I do have something significant to tell Dylan. I'm a father of 2 girls as well who are gung-ho athletes, and I have to quote my mentor, Dr. Guy Scuderi, who said that when his coach was pushing his daughters to play basketball 5 days a week, he personally went to meet with the coach, and he said to him very clearly, very respectfully, that his daughters will not be allowed to train more than 3 days a week. 3 days. Now, Dr. Scuderi is an athlete himself. His kids are avid athletes, yet the limit was set at 3 days. Now, I deal with a lot of student athletes, and a lot of gung-ho parents are all well-meaning parents. But the reality is that it's easy to push your kid too far. Elbow injuries in baseball throwers, swimming injuries, specifically shoulder injuries in patients who overdo it with swimming, injuries to the knee or to the patella tendon with significant running. So you have to give your body a chance to heal. And if you'd like to play this episode for Dylan so she hears me say this directly to her, Dylan, you gotta rest. No matter how much you want to compete, spend the other days watching videos, learning the kinematics, the mechanics, learn technique, but definitely allow your body sufficient time to heal. Thank you for this very important question. And the last question comes to us from Jared. Jared asks, "Hi, Dr. Brusovanik, what are the most common causes of sport injuries in young athletes?" Okay, great question, Jared. So I would say the list starts with ACL injuries. ACL is a very important ligament in our knee in female athletes playing soccer and basketball. Second, ACL injuries in male athletes playing soccer, basketball, or football. There are common finger injuries with wrestlers and with water polo players, as well as basketball players. Now, with the popularity of mixed martial arts, we see a lot of lacerations, which are superficial injuries, but still significant. And then I worry about boxing causing a lot of head injuries. To sum it up, I would say that I can't stress enough. 1, letting your body heal. 2, not performing the same sport activity more than 3 times per week. And lastly, for those of you who are experiencing pain after a workout, respect that pain. Sometimes you have a muscle ache or a stiff joint and you say, well, I'm just going to push through, and that's okay. But if your pain is different, if there's an electrical component, if your pain isn't getting better within a few days of rest, definitely seek care. And finally, chest pain, shortness of breath after workout, definitely seek care immediately. Thank you for tuning in, and see you at the next episode of Ask the Doc, no appointments needed.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.